Bismillah ar-Rahman ar-Rahim. First of all, I would like to thank who give me this opportunity to speak to all of you guys, to speak to decision makers, to speak to these leaders of electronic health at the empire of India. When I say India, India is the history. India, it means, or to refer us to you grandfathers, you grandmothers, you fathers as well, who transferred the knowledge during all these generations up to today. I'm sure here, I will not add that much to you. I know how India is high in technology. I know how is India a medical field so advanced. But I'm here to open my hands. I'm here. I came from Saudi Arabia. I came from one of the GCCs. Just to say, you're more than welcome. Come to Saudi Arabia. Come to our region to invest, to help people, and to collaborate together. Today, the subject is about digital disruptions and how that would affect, and it's really impact already in our life. Digital, let's just guys, let's think about that from project management scope. Do you think digital disruptions came to our life? It's just like there are some kind of trying, let's try how technology would help or something like that? Or do you believe it's a need, it's a demand, it's a high demand? In project management, they told us unless the project start from people demand, from stakeholder believes, that will fail. So digital disruptions today, it's a win-to-win contract between us as a healthcare providers and our main guests, our main stakeholder, who is the patient. Unless the patient believe the digital would help them to have an accessible, more easier for them, improve their health, and also provide them a cost-effective solutions, they will not accept it. They will ignore it. But today, digital disruptions, it does help. It does make the difference. It's the game changer today. Dr. Gupta, last event, I think he called change or game changer. And I believe e-health, it does help. That's the player who change how would we deal with healthcare providers, even here or there or somewhere. The whole, it's a globally issue. So, just briefly, guys, when you talk about digital disruptions, there are plenty of solutions. Let's talk firstly about the telemedicine. How do you believe telemedicine it does help, especially in this areas of some, for example, India, when we know about 70% of the population are in rural areas? How would they get a high quality health services? Telemedicine, it's one of these solutions. It's enable these people to contact to their healthcare providers in a security way and immediately. All of us remember how it was so difficult for these people to transit, to get to their appointment and to travel, and how that could cost them. Today, no, at the same day, at the same moment, you can get your result, you can get your prescription, you can understand what's going on, you can reach to your data, you can understand about your health, what's going on. So telemedicine is one solution of this, of high tech in health field. The other one, let's talk about electronic health record. For example, in Saudi Arabia, we have the 2030 vision, which said every citizen should have his electronic health record by 2030. Electronic health record, it does mean no need to remember your medical history. No need to take your bulky folders with you everywhere. No need. All this, it was from the past. Now, just for example, by your ID number or something like similar, your healthcare providers would have the ability to see all your history, to take the correct decisions at the correct time. There are plenty also of examples of how technology does help in to manage our health. There are wearable devices. At the same time, you could take care of your health. How's your pulse? How's your breathe? What's going on? You can contact to your doctor. It does help you as a patient, and also it does help us as healthcare providers to be proactive, to help you before it was complicated or to go to a wrong way. So also, if we talk about artificial intelligence, how that could enable us to get more correct decisions, how that would enable every healthcare providers to reduce medical errors and human errors, and also data storage as well. Plenty of ways technology does help in our health, guys. So I think Saudi Arabia, India, everywhere we are sharing the same concept. We are sharing the same demand. We are sharing the same need to use this technology to manage our health and our relatives' health properly by sharing knowledge, by sharing expertise, and also collaborate together. Thank you so much, guys, again. Thank you for Dr. Gupta, this guy who used to make the difference everywhere. And thank you for everybody here. Thank you.